Hello and welcome to your little brief lesson on estrogen. During perimenopause and into menopause, our estrogen levels are important. So, um, estrogen does so many things for our body. It's really, really valuable. It contributes to bone health. It contributes to lowering bad cholesterol, which also contributes to good heart health. It um, has a part to play in our hair growth. It also plays a huge part in our mood and even contributes to maintaining muscle mass when we exercise. Another thing it is very connected to is how our body uses insulin. So, when we hit perimenopause, a lot of times what happens is we have estrogen spikes and drops. It's what's been called the estrogen roller coaster. So before perimenopause, we pretty much have these nice, smooth lower and lifting of the estrogen throughout our cycle. And then once we hit perimenopause, all bets are off with that. So what tends to happen is at first, usually you end up getting too much estrogen. Your estrogen lifts really, really rapidly or high in comparison to what you're used to. That might contribute to PMS, irritability, mood swings. You might find yourself more anxious, more depressed, even more angry than you normally been in the past. And so we want to try to help balance those estrogen swings out in perimenopause. So some of the ways we do that is we avoid alcohol, try to limit it, especially before your period, because that's going to contribute to your PMS. Um, Even 1 ounce of alcohol can double your estrogen in your body within a couple of hours. So it's definitely something to consider. The other thing we do is we like to eat lots of fiber and plant foods because those will help our gut to be happy. When our gut is happy, it can produce all these good bacterias that will help get rid of excess estrogen in the body. And so that also will contribute to balancing our estrogen. Another thing we like to do is detoxify our environment because um, things like plastics, endocrine disruptors that are in a lot of beauty products and self-care products actually affect the way our estrogen connects to the estrogen receptors in our body. And that can contribute greatly to an excess of estrogen. So, if we have an excess of estrogen, those are some of the things we do, and we'll discuss what your particular needs are during your session. If your estrogen is now super low because you are closer to menopause or you are already in menopause, um, then we do things that help contribute to a lower level of estrogen in a healthy way. Once again, diet is crucial. Plant foods really are super important. Oftentimes, women find eating soy products can be useful. There's also lotions we can use that help naturally our body to produce a little bit more estrogen. But the bottom line is once you hit menopause, you really have a very low level of estrogen remaining in the body, and so it's so important to do things like exercise and eat well because, as we talked about, bone health, heart health, skin health, all those things are involved with estrogen. And if it's low in the body, we have to find other ways to teach our body how to be healthy, to maintain health and strength. And so we'll talk a lot about your exercise routine, your sleep schedule, and of course your nutrition to help you through that time as well. And we want to keep our mood level in either case, whether it's perimenopause or menopause. And so there's things we can do as far as nutrition goes and exercise and sleep goes that really help our mood to be a lot less anxious um, and really to be able to feel like we can focus better, less brain fog, and have a positive view of ourself. Think and talk positively to ourselves, and look at each day as an opportunity to see how strong you are and how much you can enjoy whatever phase of your life you are in. So, estrogen is super valuable, super important. We're going to try and balance it for you. Um, those are just a few of the basics that we like everyone to know about their body. See you on the next video.